Right. We want to go in depth about the eligibility expansion, what that means for Utah's vaccine rollout, and also these variants that we're concerned about. So Rich Lakin is in charge of the vaccine program for the Utah Department of Health. So we're so glad to get the chance to talk to you at the beginning of this really important week. Let me start first of all with that variant. I do want to know how concerned are you?
Well, we've received guidance from CDC quite a bit about these variants, and we are showing that the vaccine is working against these variants, and that's the important piece. So as long as we can get as many people vaccinated as quickly as possible is the key, and then we can keep this variant under control.
All right, and when we talk about that, and I mentioned that this term, the race to vaccinate, and I don't want to use hyperbole there, but you really do want to get this done as quickly as possible because you don't want one of these variants that's more contagious to really take over. Is that right?
That's correct. I mean, getting the vaccines to arms as quickly as possible, obviously, is the key, because the more people we have vaccinated, the better off we are to reach that herd immunity, and that's where we want to get. And if there's variants out there, if this variant has nowhere to go, if it doesn't have a host because that person's vaccinated, it can't spread. Mm-hmm. The science of it is pretty simple. That it needs a host, and when people are vaccinated, those hosts are less likely to be available to that COVID vaccine, COVID, and also any type of variant, as long as the vaccine works against it. And it's shown that it is so far.
Well, it seems like the vaccination program is going very well in Utah now. At first, maybe we weren't getting as many folks vaccinated because we have a younger population and thus a less at-risk population to some extent. But now we've really caught up and passed a number of states. But what is your concern going forward? Are you worried about people who are not willing to get it?
Yeah. So we're clicking at a pace right now that rivals any state right now. We rank anywhere from 4th to the 11th in getting the vaccines out. And my concern is two things. Number one, we're not getting enough vaccine. That's the concern. And our capacity with our partners is 300,000 per week. We can do 300,000 per week. So that leads me to my next concern, and my next concern is vaccine hesitancy. Yeah. We want to ensure that people get vaccinated. If you look at history, vaccines have decreased many vaccine-preventable diseases: measles, mumps, rubella, smallpox. I mean, I could go through the list. This is another one on the list, and in order to reduce it, we've got to ensure that people don't have vaccine hesitancy and that they realize that the vaccine is the way and to get rid of this and the light at the end of the tunnel.
I want to ask another question about that, and then I want to go back to your first concern that you mentioned there. But on vaccine hesitancy, that's right now you're getting the low-hanging fruit, the people who are excited to get the vaccine. Honestly, today, I live in Salt Lake County, so today was the first time I could sign up. And boy, 9 a.m., I was on that website to get signed up. I am excited to get this vaccine, can't come soon enough. How do you get to those people who aren't the low-hanging fruit like me?
Yeah, I think it comes down, people are going to have their freedom of choice, right? And we understand that. We don't condemn anybody that doesn't want to get the vaccine. The thing that we really, I think, need to look at is we've got communities within the state of Utah. We've got, the state of Utah as a whole. We've got bordering states. And in order for us really to curb this outbreak that we're having and to reduce the number of cases where we can get back to normal, is we've got to reach those. And we just need people to, hey, you know what, just take a step up and care for your neighbor, care for other people. And we're just going to have to continue to educate that this is a safe and an effective vaccine. And that's the reason why we want people to get vaccinated.
Okay, and while not condemning, I mean there is something to it of in terms of simply saying it is the right thing to do. I mean, if we need people to be vaccinated in order to get rid of this thing, I think is what I'm hearing you say. You can tell me if I'm wrong on that, but I did want to ask about not getting enough vaccine as well. Did you want to add anything to that?
Sure. So, I mean, it's been a problem for a long time, right? Not get, states not getting enough vaccine. And the significance of that is basically that we can't vaccinate at a pace that we'd like to. If we had 300,000 doses per week, times that by 4 weeks, that's 1.2 million people we can have done in a month. And that's significant. That's the capacity that we've built to ensure that we can get vaccines into arms as quickly as possible. We understand it. We don't want to rush the vaccine. We want it to be safe and effective. And there's a lot of quality checks that go into making a vaccine. It's not like a spoon that you get out of plastic spoons. If you get one bad plastic spoon in there, big deal, you throw it away. You use the other 25 of them, right? The one thing we don't want is a bad batch of vaccine to go into arms. And so we get that we would rather have it to be safe and come out at a slower pace than to rush the vaccine out and not have it be safe.
All right. Well, that is all the time we have. There's so much more I could talk to you about, including AstraZeneca getting approved. We'll probably have some more doses coming around the country from that as well. But really, Rich Lakin, thank you for taking the time. Thank you for the work you're doing to get us all out of this thing.
Thanks for having me. I appreciate it.